This video is part of a collection of testimonials and stories about the personal and professional impacts of public health emergencies. This project aims to uplift authentic experience and impactful efforts to enhance the capabilities of agencies who serve maternal and child health populations and help guide their use of existing resources and implementation of best practices in their communities.
My name is Micklina Kenyi, and I immigrated to the US in 2003 as a refugee, and then I went to CU in 2004 and graduated in 2008. I, of course, then got married, had one child, and after I went back to school to do my master's, and I graduated in 2014. And what I'm doing, with a nonprofit organization that I helped found, and it's called Empowerment Through Education. We are sponsoring girls to go to school. They support themselves, to support their families, and to have a voice instead of having someone to speak on their behalf.
Tell us about your personal experience responding to a natural disaster and how your feelings shaped your response to the emergency.
The challenge I had mostly was during the Marshall fires in Louisville and Superior and parts of Boulder. We were just home. That was the last day of our work before we go out for Christmas holidays in December. And there was kind of not so much winds, but later on it picks up. And all of a sudden we started seeing there was a smoke coming. So, and then the winds just kept picking up and the fire started jumping from one side to another. The fires start spreading all over. And from there, it gets so scary and so bad that I told my mom, okay, let's pick some other documents that we have in case the fire reach this side, we'll at least have things handy. So we picked some documents in the house and I picked pictures. And then the worry was like, oh, did we get everything out? How about my mom's information for like her documents? And before we know it, my neighbor came and knocked and she said, oh, we might be evacuating soon. And then she came back again. She said, well, get your things ready. We are getting evacuated. From there, I started panicking. I got a bit confused. I wanted to cry and I want to believe and I don't believe it. And it's like, is it real? And I can see every minute something is happening. Before we know it, the sheriff come and knocked at our door saying like, you need to get out of here. I was almost passing out. I could not believe it's happening here because I thought like being in America, things are okay, you know. You can never get any emergencies to an extent that you can be moved from your house right away. Took me back to when one time situation in South Sudan happened whereby we got shelled by the government when during the fighting years in South Sudan. And at that time, there was nothing. You cannot think of anybody. You can't think of anything. You just want to put your head where you feel it's safe. So it took me back to that time. And I felt I've grown and I'm strong enough. I can handle emergencies. But when that time happened, I could not even understand myself. So I was super scared, terrified, had mixed emotions, at the same time trying to be strong and let the kids see me as their mom not in a panic, but strong so they can also stay strong. And it was just something I've never experienced and thought that one day we'll be in this situation in the US.
How did your community respond to support those who were impacted by the wildfires and evacuation orders?
When the fire happened and people got evacuated, uh, there was a lot of emotions and mixed feelings and confusion. And then I believe it took a couple days for the local government here to figure out exactly what needs to be put in place to support the people who are the victims of the fires. They set up an emergency place in Lafayette. The resources that were there, I really appreciated so much the city of Boulder because they set up that emergency place, tables from FEMA, Sister Carmen, the city of Louisville, the city of Superior, Lafayette, home insurance, places where you can get snacks, places where you can go and get clothes, and all the resources were there. And I was able to be assisted. But of course, it wasn't just something random, but you have to go through a system that was set up in order to address each person at a time. And it took us a couple days to know exactly what we need to do and how we need to go about. And then the follow up later on. Of course, by then everybody wanted help. And the nature of help that we need, like the people, the victims, varies based on what you experience with your house.
How do the barriers you faced highlight the need for equity being centered in emergency response efforts?
The language and the culture is different. With so many resources that were available, you need to be accustomed by the way Americans do things. But with our culture, it took me and my family more than 3 or 4 weeks to know exactly what we need to do. I know I can read, I can write, but there are some things that are put in policies. For example, like the home insurance. Their language is completely different. You need to know exactly what you have in your coverage in order to ask for services. If you don't know, nobody will volunteer, or no insurance will volunteer and tell you, oh, this is what you need to do to get the services we have, or the services you signed to have. You can be polite, but be persistent and direct to what you need to do or to get, and keep talking and telling them this is what I need to do I need to get based on my needs, and it's covered in my insurance. I need someone who can come and have an eye on what I'm going through and put him or herself into my position in order for them to know exactly what am I needing from them to do. It took a couple months before I could land into the right person who can help. We were lucky because we had other people, other friends that we can reach out to and ask. But I know there are many people who are non-English speaking who could not even read to know exactly what they need to do. There are some people who are even Americans who are not familiar with what needs to be done in order for them to get services. That's also a barrier. So it's not easy. the culture itself is different. Within the American culture, there is the culture of the home insurance. You need to be familiar with that. Within the culture of this home insurance, there is the culture of people, inspectors that are coming to inspect your house. So within every culture, there is a culture. You need to know the layers of cultures that you need to navigate in order for you to get what you need.
What considerations would you like to share with agencies who serve maternal and child health populations?
What was a bit missing was it took a couple days for the companies that came there to help to process paperwork to be able to provide the assistance. So if the amount of days were to be shortened to some extent, that will bring down the worry, the anxiety, and the stress people go through. But then what I saw based on my needs at the time or my family's need was like transportation to bring people to where they want to go and see their houses and go back. The next day, it took us 4 hours to come back and see our house if it's standing or not. And we walked for a couple miles to be able to reach our house. So what was missing was like if there were buses to put people in and bring them based on their neighborhood, at least to facilitate that, because I saw a lot of elderly people walking, coming to see if their house is burned or not, or if the house is okay. Some, of course, with the worries and emotions people go through, I think it would have been better or easier to have buses to bring people in to see the situation and then go back. Medicaid is not considering all the hassles that people go through, especially people of color. There's so much that needs to be understood. And it is just like if my mom, who has someone like me who can help translate for her, is going through this, how about someone who has nobody to help them navigate all the roads and all the paperwork and things that need to be done in order for them to get the services they need?
Thank you, Micklina Kenyi, for sharing your family's harrowing evacuation story and offering thoughtful considerations for the MCH workforce in responding to future public health emergencies. This anthology is curated by the Association of Maternal and Child Health Programs, or AMCHP, through a project funded by the Centers for Disease Control and Prevention, or CDC.